Hi, my name is Dr. Denton Watumull. I'm a board-certified plastic surgeon in Dallas, Texas. I'd like to introduce myself. I was born in Honolulu, Hawaii. I went to Punahou High School. In high school, my passion was art. I was a glass blower and thought about it as doing that for a living for a long period of time. I had the good fortune to play water polo. I was a high school All-American in water polo. I graduated with academic honors, then went to Claremont McKenna College, magna cum laude. I went back to my hometown of Honolulu, Hawaii for med school. It was an up-and-coming school. I wanted to be in my hometown, had a wonderful experience. From there, I had graduated with the prestigious Alpha Omega Alpha Society and went to Southwestern, which was a top-ranked trauma and general surgery program. I then went to the #1 ranked plastic surgery program in the country at UT Southwestern, and then did an extra year of hand and microsurgery fellowship. So my residency, I guess I wasn't a quick learner, was in 3 different specialties and was 9 years after medical school. I started this practice in 1991. I was recruited to Garland, Texas from UT Southwestern. At the time, they did not have a plastic surgeon. They didn't have a hand surgeon, and it was the same size as Plano. And things got busy quickly. We've grown to 3 and soon to be 4 physicians. We have 3 offices. We have nearly 50 employees. I do think we've got one of the best practices in Dallas in terms of excellent people around us, well qualified and happy employees. As soon as we cross the 50 mark, we want very much to be on one of the top places in DFW to work. I think that why plastic surgery is so unique and so great is that you actually transform people's lives fairly immediately. You take something that someone feels horrible about, you have a horrible injury, you have a look that someone really can't stand, and you're able to impact it in a very meaningful way, very quickly, very immediately, and with long-term results that are with them for the rest of their lives. I do think that there is a line which physicians need not to cross, and that is to be 100% honest about what we can deliver and what is appropriate and what's a good choice and what isn't a good choice. We have to honestly put ourselves in the other side of the consultation chair and go, what would I want? How would I want to be treated? What's the most beneficial thing for them, even at my expense? We commonly, in my practice, will have patients come in wanting certain procedures and have an idea that this might be beneficial, and we have to say, honestly, the best thing for you is to have nothing, maybe for 5 years, and you don't need a facelift now. We would recommend you come back in 5 years, or perhaps the implants that you had in mind are too large for you, and maybe you should rethink this. But good plastic surgeons will commonly tell people when it's in their best interest, no, this isn't a good choice. One of the biggest questions our patients will have is, what will my experience be like with surgery at your facility? First of all, we have worked very hard to make our place the most safe and quality place that they can possibly have a procedure. Our surgery center is accredited, it is state inspected, it is Medicare certified, it's on insurance plans. So we have every safety bell and whistle that you could possibly wish for. It has backup generators, it has backup safety equipment. We have on-site, on average, 3 to 5 RNs for every procedure. Our surgery center nurses have a combined experience of probably 4 decades being in an operating room. Most of our techs are heart scrub techs, so they have been in the most intense procedures you can possibly have. So our surgery center accreditation is very important to us, and so we pride ourselves that we treat our patients the way we treat our children and our family members, that they get the same safety precautions that anyone in our direct family would have. We also not only pay attention to the basic safety considerations, but we try hard to pay attention to comfort. We try to make it a wonderful experience, and I think our patient satisfaction rates are among the highest in the industry. I feel very privileged at this point to be chosen by Top10MD because I think Top10MD does an excellent job at credentialing their physicians, and not just anybody can be chosen. You have to have excellent credentials, you have to have an excellent track record with your patients and your colleagues, and for that I respect Top10MD very much. We had an ad and a patient educational campaign which showed a woman looking at her shoes, and we made the comment that many patients spend more time choosing their shoes than looking at the credentials of their plastic surgeon.